And welcome to the Medicare Open Enrollment Community Meeting. My name is Paulette Peeples, and I am the Medicare 100 Plus Coordinator for Champaign County Healthcare Consumers. I am also the organizer for the Medicare Task Force. Healthcare Consumers is a grassroots consumer health agency organization, and we were founded in 1977. We provide free individual help to hundreds of people every month who are having problems with the healthcare system or who need access to healthcare. And we also do community organizing in order to make improvements in our healthcare system. Our mission is healthcare for all. Today's meeting is brought to you by the Medicare Task Force to provide you with this information about the basis of Medicare, your Medicare coverage options, and Medicare annual open enrollment. This community meeting is co-sponsored by Barham Benefit Group, Carl, Christie Clinic, OSF Heart of Mary Medical Center, Health Alliance Medical Plannings, Cunningham Township, and Promise Healthcare. Before I give you an overview of today's meeting, let me take care of some housekeeping details. If you have a cell phone, please turn them off or at least turn the ringers off. Second, the restrooms are out the door and to the right, and you can use them whenever you need. Third, we do have refreshments, and you should feel free to get up and help yourself at any time during the meeting. Okay, those are the three things. We are holding this meeting to help provide information to those of you who are on Medicare beneficiaries or help care for someone who is a Medicare beneficiary. We want to give you the basis of Medicare, help you understand open enrollment, and let you know about some important resources and programs to help make Medicare costs more affordable. Now I want to tell you about how we're running this meeting, so you know what to expect. Everyone should have an agenda packet that includes the agenda and some informational materials. We will run a tight program this morning, so we will follow the agenda. Now I'd like to invite Claudia Lennhoff to come up to make her presentation.
Good morning, y'all. Good morning. My name is Claudia Lennhoff, and I'm the Executive Director at the Champaign County Healthcare Consumers. Thank you all for being here. Before we get started, I wanted to ask y'all some questions just so we know who's here and what kind of information you might be looking for. So, how many of you who are here have Medicare or are here on behalf of somebody else with Medicare? Okay. How many of you are new to Medicare or fixing to be new to Medicare? Okay. How many of you here have a Medicare Advantage plan? How many a Part D plan? Okay. And some of you are not sure what you have, so we'll help you sort it out. And then, are there individuals here who have both Medicare and Medicaid? Okay. And do any of you have Medicaid with a spend down? Okay. All right, good. Well, I think we have the information that should be able to help everybody. So I'm going to talk about Medicare basics to start. So this section is sort of a good overview of Medicare, especially for people who are getting into Medicare, have just started with Medicare, but it's also a good review for people who maybe are already in Medicare. So what is Medicare? It's a federal health insurance program for people who are age 65 and older, people who are under age 65 with certain disabilities approved by Social Security, and people of any age with end-stage renal disease. You pay into Medicare while you work through your payroll or FICA taxes. The Medicare card. The Medicare health insurance card used to be the red, white, and blue card, There are different coverage parts to Medicare. So it used to, well, they both still indicate Part A and Part B and your eligibility date. But between April 2018 and 2019, Medicare will be mailing new cards to every beneficiary. How many of you have gotten your cards? Okay. With your old cards, you should really destroy those or put them away and keep them somewhere very, very safe. They have your Social Security number on them, so that's why people are being encouraged to put those away. Since you have your new cards, or when you get your new cards, when you go back to see your doctor, whoever your provider is, you should take your new card with you, and you might need to ask them if they need to scan it in. Some providers are doing that now. Okay, so we're going to talk about the Medicare parts. So Part A is the hospital insurance. Part B is the medical insurance. Part D is the prescription drug plan. And we'll talk about Part C a little bit later. So Medicare Part A, the hospital insurance part, is free. There's no premium for most people who qualified based on disability, have worked and paid into Medicare for at least 40 quarters, or were married to somebody who qualifies. Most people don't pay a premium for their Part A. If you do not qualify for free Medicare Part A, there are ways to pay in as well. So it's the hospital insurance, and it does have a deductible of $1,364 in 2019 per hospitalization. So as we go through this presentation, you'll be seeing the ways that Medicare leaves you with some out-of-pocket responsibilities, which can be burdensome for some people, and then that's why we'll talk about insurance options available. Medicare Part A covers your in-hospital overnight care, skilled nursing facility care, not for long-term care, but for short-term care, hospice care, and some home health care. Now, Part B, the medical insurance, it typically costs about $135.50 per month, and it's deducted from your Social Security benefits each month under most circumstances. Original Medicare Part B has an annual deductible of $185 in 2019. So there's the monthly premium that comes out of the Social Security check, and then there's a deductible of $185. There is a penalty if you do not sign up for Part B when you become eligible, and if you do not have what's considered creditable coverage. A lot of times people have coverage through their employer and they don't want to switch over to Part B yet, and as long as that coverage is considered creditable, you're okay, and when you're ready to switch into Part B, you won't be facing that penalty. Part B covers doctor services, outpatient hospital care, emergency room visits, ambulances, blood and lab work, durable medical equipment, diabetes testing supplies, some home health care, and covered preventive services. So this is really the bulk of your coverage. Most of the health care we get is the type that is covered by Part B. Now, what Medicare does not cover for people who are going to be new to Medicare, Medicare really does not cover vision services. It won't pay for your glasses and so on. It will cover cataract surgeries and glasses in between the surgeries, but it doesn't in general cover glasses or contact lenses in most situations. It doesn't cover dental care. So this is a lot of times why we see really some serious problems for older folks with dental care and the ability to afford that care. It doesn't cover hearing aids, and most of us know how incredibly expensive hearing aids are. And it doesn't cover long-term care or custodial care, like in a nursing home. Okay, now we'll talk about Medicare Part A and B enrollment. So enrolling in Medicare Parts A and B is through the Social Security Administration. You will be automatically enrolled if you are drawing Social Security, retirement benefits, or after you've been receiving SSDI disability payments for 24 months. Social Security will send your Medicare card in the mail. If you are not taking your Social Security benefits, some people continue to work longer and they don't take their Social Security benefits when they first become eligible, and then that requires a little extra attention to enrollment in Medicare. So your initial enrollment period, your IEP, for Medicare is 3 months before you turn 65, the month of your 65th birthday, and 3 months after you turn 65. So if you're going to be new to Medicare, you really have about a 7-month period when you can enroll in Medicare. So who needs to enroll during their initial enrollment period? If you do not have health insurance, you should definitely enroll when you're eligible during your enrollment period. If you have Medicaid or have a marketplace plan, you do need to enroll during your initial enrollment period because marketplace plans don't cover you once you turn 65, and Medicaid may or may not continue to cover you, so you need to go into Medicare. And Adani is going to talk more about this transition in the next presentation. So the general enrollment period. So this isn't your individual enrollment period, but the general enrollment period. This is if you miss your initial enrollment period and you do not get a special enrollment because of loss of coverage or something. Let's say you didn't enroll in Medicare when you were first eligible because you had, work health insurance, but then all of a sudden you lose your insurance. That would be a special enrollment. So if you don't have any of those circumstances, you can enroll during the general enrollment period, which is from January 1 to March 31 of each year for coverage, starting July. So your coverage would start July 1 of that year. So if you've missed out, you have another shot at it. Okay, now we're going to talk about Part D, the prescription drug coverage. So Medicare approved private insurance companies offer plans with varying premiums. You may have already been getting mail about these plans. Yes. Part D helps to cover the cost of prescription drugs, and Part D is sort of, well, I'm older, so to the younger people this doesn't make sense, but Part D is sort of new to Medicare. It was instituted in 2005, 2006, right? So it's sort of a new part of Medicare. To those of us who are older. Each Part D plan has different formularies and different tiers for their medications and different pharmacy networks. It does sometimes. And one of the things to pay attention to now is with the new Part D plans coming out, you really need to look more closely at the pharmacy networks because this is something that Part D plans are using with more and more frequency, sort of limiting where, who they work with. And so it might be that they cover all your medications that you want, but you might need to really pay attention to which pharmacies you need to go to for your insurance to work with your medications. There is a penalty if you do not sign up for Part D when you become eligible, and if you do not have some other form of insurance that's considered creditable coverage for your prescriptions. Enrollment is through Medicare during your individual enrollment period or when you lose creditable coverage, as well as during the annual open enrollment period, which we are in right now. Okay, now I'm going to explain different coverage options. As you remember from Part A, there's a deductible if you're hospitalized. Every time you're hospitalized, that can be a lot of money. Part B, you have monthly premiums, but then you also have kind of a small deductible. But Part B also covers like 80% of your care, and then you're responsible for about the other 20%. So you're left with a lot of out-of-pocket responsibilities under traditional Medicare, and that's why a lot of people look for additional coverage options to complement their Medicare coverage. So it is important that you have some form of hospital, medical, and prescription coverage to access the care that you need and to avoid penalties later on. You do have options. You can set up your coverage in different ways that best meet your financial and health care needs. So, we've simplified everything. Here are your Medicare coverage options. This is what you can overlay on top of your Medicare coverage. Over here, you can keep your original Medicare using your Medicare card that has your Part A and Part B. You pick a Part D plan for your prescription drugs, and then you can decide if you want additional coverage through what's called a supplement, a Medicare supplement or Medigap policy. On the other side is the Medicare Advantage plan. This is Medicare Part C, the Medicare Advantage plan. And it rolls everything all into one plan. And it's the one card that you use. You don't need to show your Medicare card plus a supplement card. You just basically use this one card. It is usually a private HMO or PPO plan, and it combines Part A, Part B, and Part D, your prescriptions, all in one. A lot of times people, well, it depends where you live and what their networks are, but a lot of times people like the Medicare Advantage plans for the simplicity of it. But it's up to you. Part C gives you the option to have private coverage for your Medicare benefits through Medicare Advantage plans, which are offered by private insurance companies that have a contract with Medicare. So any Medicare Advantage plan being offered has been approved by Medicare. When you enroll in an Advantage plan, the insurer takes care of your Part A and Part B benefits, as well as typically your Part D benefits. Advantage plans may offer some additional benefits that are not covered by original Medicare, including some hearing, vision, and or dental benefits. That's another reason that a lot of people like the Medicare Advantage plans, because you get more coverage of things that Medicare doesn't cover. Vision and dental in particular. In the past, okay, so this is a change. In the past, if you were unhappy with your Medicare Advantage plan, you had from January 1 through February 14th to drop out of it and switch to traditional Medicare and a Part D plan, to sort of go back to traditional Medicare and then pick up a Part D plan. But you didn't used to be able to change from one Medicare Advantage plan to another unless you qualified for a special enrollment period, like if you moved, out of the area. But now you will have from January 1 to March 31 to switch to a different Medicare Advantage plan if the one you chose doesn't end up being a good fit. So right now during open enrollment, if you choose Claudia's Medicare Advantage plan and you start using it and you say, I don't really like this, it's not working for me, the network is too narrow, or I really need dental care and they don't cover it, but Adani's Medicare Advantage plan does cover dental care, I'd like to switch. Now you are allowed to do that up until March 31st. So that's new. You didn't used to be able to do that. Now going back to talking about supplement plans, that's when you have your Medicare Part A, your Medicare Part B, Part D for prescriptions, and then you want some extra protection against the out-of-pocket costs. You might consider getting a supplement plan, also known as a Medigap plan. So those cover what Medicare covers, and they go wherever Medicare goes. So anything that Medicare covers, and then you have some out-of-pocket responsibility, let's say you go to the doctor, it covers your doctor visit, but you have some out-of-pocket responsibility, the supplement will come in and help out with that and lower your cost. If you travel and you go see a doctor someplace in another state and they accept Medicare, your supplement plan will be accepted over there. Those are the rules of these. They help reduce the 20% co-insurance and deductibles that come with your Medicare plans. They do not, however, include prescription drug coverage, which is why if you use a supplement, you also need to have a Medicare Part D plan for your prescription drugs. By the way, that handout or that graphic that I showed you, the little tree with Medicare and then the Part A and B and then the Advantage on the other side, you have that in one of your handouts. Supplement policies are organized and sold by plan levels. This is helpful in comparing plans because a Plan F policy from one company is the Plan F policy from another company. Now it gets confusing because we have Medicare Part A and Part B, D and C, and then the supplements also have letters to correspond with their different plans. But what's important for you to understand is those plans are divided into coverage levels. They're lettered, and like we're saying, a Plan F or Plan F for Claudia's supplement plan is the same, will cover the same things as Plan F under Adani's supplement plan. Some companies do not sell policies at all levels, but they all must offer at least a Plan A policy. And while Plan F policies tend to be the most expensive, Plan F policies also provide the most coverage. And you have a chart in one of your handouts that lists out what the different levels of coverage
It's
are.
on the back of the yellow.
Thank you, on the back of the yellow. Now, there's some different rules with supplements compared to Advantage plans. Okay, with Advantage plans, you can pretty much enroll at any point after you've qualified for Medicare. With supplements, the rules are different, and it's really important to pay attention to this. The supplement Medigap open enrollment period is a one-time 6-month period when a Medicare beneficiary first enrolls in Medicare Part B. As long as you apply during this period, you cannot be turned down for coverage. In other words, it's guaranteed issue. It doesn't matter if you had 3 bouts of cancer, or heart disease or whatever's going on, they cannot turn you down for coverage. Only during this 6-month period. Now, the policies must be sold guaranteed renewable, meaning once you get one of those policies, regardless of what happens to you or your health, once you get one of those policies, they're guaranteed to be renewed every year. Okay, so once you're in, you're in. And usually people with supplements don't ever change them for that reason. They can, however, be canceled due to late payment or false statements made on your initial application. I know none of y'all would make false statements on your initial application. With these policies, the goal is to get a plan and to stick with it. You are not switching these plans every year. You can switch Medicare Advantage plans as you need to, but you are not switching your supplement plans. After your initial enrollment period, there aren't annual enrollment periods for supplements. If you are receiving Medicare due to disability, you will pay the highest premium allowed before age 65. So if you're a person who got Medicare by virtue of disability and you're under age 65, your supplement's going to charge you the highest price allowed. But when you turn age 65, you have a second open enrollment opportunity to seek out and receive the same premium rate charged to people who are age 65. So this is comparing the supplements and Advantage plans. So again, this is sort of a more detailed version of that other graph. But supplement your original Medicare Parts A and B. They have the same benefits across companies. They generally do not have network limitations. They go anywhere that Medicare is accepted. Medicare will pay first and then the supplement, and then you pay any remaining costs. It only covers expenses covered by Medicare. These plans tend to be more expensive. They may have age and tobacco rating, meaning if you're a smoker, you may get a different premium, and they may have medical underwriting. Advantage plans sort of replace your Medicare because they cover everything directly. Benefits may vary. They generally have a network because they're usually an HMO or PPO with a network. The plan pays, and then you pay the remaining co-pays or co-insurances. For a lot of people, they know exactly what their copay is under an Advantage plan whenever they go to the doctor. They might have a copay of $20 or $25 or whatever it is for every doctor's visit. And so you sort of know exactly what you're going to be asked to pay. They frequently cover additional services, including vision, hearing, and dental, and they tend to be less expensive. They don't change their premiums based on your age or tobacco ratings, and they don't have medical underwriting.
What is medical underwriting?
Medical underwriting will be answered by John Katsinas.
That just means that the insurance company can look at your application, they can ask you health questions, and based on your answers, they can say they will accept or decline. But for instance, it used to be if you had cancer, they wouldn't take it.
Thank you.
Thank you, John. It helps to have an insurance broker from Barham Benefit Group in the audience. Yeah, so one thing to know, you can get a supplement later on. Maybe. You can apply for a supplement later on. If you don't get it during your enrollment period when you turn 65, you can try to get a supplement later on. But at that point, It's not guaranteed issue. They are not required to cover you, and they can also charge you a really high premium. That's why we say if you think you want to supplement, you really need to get in on the ground floor when you become eligible for Medicare, because the rules change later on for supplements compared to Advantage plans. So, with regard to Advantage plans, when you first qualify for Medicare due to turning age 65 and join a Medicare Advantage plan, you have a trial period. You can drop that Advantage plan. This is your first Advantage plan. When you first qualify for Medicare, you can drop that Advantage plan within the first 12 months and get a Medicare supplement with guaranteed issue with no pre-existing wait period. So that if you don't take a supplement immediately when you become eligible for Medicare because you want to try a Medicare Advantage plan, you can do that and still be able to switch over to a supplement, but it can only be during that 12-month trial period. After that, if you don't switch to a supplement, and then let's say you want to switch like 3 years later, all bets are off as to whether they need to accept you, how they're charging you, whether they're going to cover all your conditions and all that. So,
can you switch from a supplement to an Advantage?
yes, you can do that. But again, there's remember that there are enrollment periods for Medicare Advantage plans. So
you can't jump into an Advantage plan at any time. So if you just decide, oh, I'm going to turn off my supplement coverage, now you don't have any coverage unless you're in an open enrollment period for that Advantage plan.
But isn't open enrollment right now?
Yes, exactly.
Okay.
So
Yes.
right now you could do
Okay.
that, but if, like next year in the spring, you wouldn't be able to turn off your
Right.
supplement and try to get onto an Advantage plan
Okay.
unless you had this other circumstance where you had involuntarily lost your coverage.
Okay.
yeah, that's why we're having this meeting
That's
now,
right.
because this is actually your
That's what I want to
opportunity
find
if
out.
you would like to switch over, or for Part D also, this is open enrollment. And even if you have a Part D plan that you like, we really encourage everybody to look at their plans, make sure they're still working for them, because as you've seen, there's only certain times when you can change
Right.
plans.
Right.
Yep. Okay. When you first purchase a supplement policy, you have a free look back or free look period of 30 days. So during that time, you can cancel your policy and you will be refunded your full premium. 30 days isn't a very long time.
No.
And it's not a very long time to experience insurance. But if you just if your well-meaning daughter signed you up and it's not what you wanted, you have 30 days to get out. I'm not speaking about anybody I know. You cannot have both a supplement and an Advantage plan. It's one or the other. And now, to talk about the actual open enrollment period, here's Adani Sanchez.
All right, good morning, everyone. Thanks for being here. I'm going to be talking about Medicare annual open enrollment, which is October 15th through December 7th, and this happens every year, and it's the same time every year, so it's something that just regularly happens. So again, like Claudia was saying, we really encourage people just every year during this time, just think about what your prescription plan is, kind of revisit what your health insurance is. And this open enrollment is for the next calendar year, so these are for plans that will start January 1st, 2019, and then go all the way through December 31st. This is for Advantage and Part D prescriptions. Like Claudia explained, this is not for supplement policies. Supplement policies only have that first open enrollment period when you first turn 65. Otherwise, you're just kind of have to apply and kind of wait and see, but they don't have general open enrollment periods. So really, every year, Advantage and Part D plans are the ones that are coming up and for renewal. If you have extra help or full Medicaid, you can switch throughout the year, so you have a little bit more flexibility. So if someone had Medicaid and they wanted to switch into a different Advantage plan or change their prescription plan, they could do that, next March. And that wouldn't be a problem for them because they have extra help and they have that flexibility. In 2019, the prescription plans, there are going to be 27 plans available. The premiums range from $24 a month to $70 a month. Most of the plans have a deductible of $415. So this is separate from the Part B and the Part A deductibles, right? So we're very compartmentalized in Medicare. So many of these drug plans are going to be, you have to spend about $415 on your medications before they start discounting your medications. This looks a little bit different if a lot of your prescriptions are generic. So it's a very small number, so you're usually getting a discount already, because if your prescriptions are considered generic, they're generally just cheaper, so they're willing to give you like a flat rate on those, so you're not necessarily having to spend a full, too much on those generic plans. But if you're taking a lot of expensive medications, this is something that you're going to have to maybe think about when you're looking at a prescription plan. You want to look more. You want to look at more than just the premium. How does the plan cover your medication? So again, with things like a deductible in play, you're paying a lot up front very early on with your prescription plan. So you need to think about how are your prescriptions covered on this plan. And because all the plans have different formularies, it could look very different between the plans. So that's another reason to make sure that you're looking over the formularies. If you have a prescription drug plan right now, a couple months ago they should have sent you a change in benefits. So if they're not covering a certain prescription anymore, or they're not covering a certain generic, or they're getting rid of something, or they're changing the tier of a prescription, they'll let you know in writing. And so it's important to kind of take a look at those and make sure that that isn't changing year to year. Coverage levels. So what you're paying are going to be the deductible. So if your plan has a deductible, you have to pay $415 before you can get to your initial coverage, which is where they discount the medications. And then the coverage gap, also known as the donut hole, is where they're like, well, you take a lot of prescriptions, it's been kind of expensive, we're going to not help you as much pay for these prescriptions. So now you have to pay more out of pocket when you're in the coverage gap. So you're usually going to get into the coverage gap if you have pretty expensive medications, and we'll talk about the details and what that number is, that price, in just a little bit. And then after you get out of the donut hole, it's catastrophic coverage, which means they're going to be discounting your prescriptions even more than they were during your initial coverage, because you kind of made it through the donut hole, so now they're actually going to help you a lot more. The donut hole, like I said, is a coverage gap that some beneficiaries encounter during the year once they've reached $3,820 in 2019 in total drug costs. So this isn't what you've paid out of pocket, it's what you and your health and your prescription drug plan have paid. So if you're on a very expensive prescription, again, a lot of insulins are very expensive. Those are like $500. If you've got a lot of insulin, you're going to be reaching towards that donut hole very quickly, and you're going to reach it earlier than maybe some other folks. For 2019, after the total cost of your drugs reaches $3,820, you'll pay up to 25% of the cost of the brand name drugs, and then 37% of the cost of generics until you spend $5,100. So this is, think of it as like on a line, and that's when you get out of the donut hole, is at $5,100. And then you'll get into that catastrophic coverage that we were just talking about. So you'll be in the catastrophic phase, and then you'll pay no more than a few dollars for each prescription. For expensive drugs, it'll be no more than 5% of the cost of the drug. So again, once you get into catastrophic, it's a very high discount because you've already spent so much. The cost you pay during the coverage gap is capped as a percentage of what the plan pays for the drug. And then the donut hole is sort of being phased out and is scheduled to close in 2019. So the percentages will be much lower of what you have to pay after that. The Advantage plans for next year, there are about 14 different plans offered from 2 different companies. The premiums range from $3.99 to $71 a month. And the things to consider are, does it cover your doctors and hospitals? Advantage plans do have networks because they are offered by private insurance companies. So they do have networks with certain doctors and hospitals, so you want to think about who's in network. You also want to think about how does it cover the services that you regularly use. So maybe you've got a lot of lab work, and so you want to make sure that that lab work isn't at 20%, because the whole point of getting an Advantage plan is to help reduce that 20% that you'd be otherwise responsible for. So some Advantage plans have like co-pays for x-rays or lab work and diagnostic tests. So those are things to look at. What do you get regularly? And then does it cover your medications? Advantage plans include prescription coverage. So again, that's another formulary that you're going to have to look at and see how it covers your prescriptions and how much it costs to cover your prescriptions. So again, you're going to be looking at more than just the premium each month. When you're getting ready to enroll, when you're getting ready for open enrollment, you'll want to read your annual notice of changes, which is the official term of what I called earlier the explanation of changes. So you'll want to see what your current plan is doing and seeing if they're changing anything, or if you want to just look at something new, you also have that option. You want to review notices from Social Security and Medicare regarding eligibility for different programs. So as your situation changes, you might become eligible for extra help, or you might become eligible for some other programs. So you just want to make sure that you're paying attention to mail from Social Security and Medicare, because I know that y'all are getting inundated with lots of like advertisements. I know you're getting all sorts of stuff, but really Social Security and Medicare, those are the ones that you really do want to pay attention to, because sometimes they can send you some really good stuff. And check your plan. Even if you love it, just check it. Networks change, medications change, and they do change every year. So even though you're like, oh, I'm going to be fine, and then what if you're not fine and you have to wait until October to change for next year? So it's worth it. It's not too long. We try to make it easy and painless. So you can always give us a call. Or Candace is back here taking appointments as well. So if you just want to review what you have, that's also good. And we try to make it easy and we try to make it helpful. You can review plans online. You can also enroll online at Medicare.gov. You can also call 1-800-MEDICARE, or you can meet with someone in person, a SHIP counselor. So again, Candace is a SHIP counselor. So she's taking appointments today, so I encourage y'all to talk to her. We also offer in-person assistance. And then also, if you feel comfortable online, going to Medicare.gov, you can complete the enrollment. You can look at it all laid out in front of you. They make it pretty easy. What you need for open enrollment, so the things that you'll want to bring with you to an appointment, or you want to have on hand when you're talking to someone over the phone or on the computer. You want to bring your Medicare card, a list of your doctors, and the list of your medications. The pill bottles are nice because they have the dosage as well, which can sometimes affect the price of the medications. If you need help, you can always set up an appointment for in-person assistance with a SHIP counselor. And then we've got some information here on oh, I did call it right. OSF Hard and Mary Senior Programs. That's who Candace is with. So these are the places you can contact to get SHIP help. We talked about mail a little bit. We've kind of been joking about it. Things that Medicare plans can do to advertise, they can, but they do have to follow certain rules when promoting their products. They can market their plan through direct mail, radio, television, and print advertisements. They can even come to your home under certain circumstances, but only if you've invited them. So we had, I don't know, a couple years back, someone who was just knocking on doors and like cold visiting people to try to sell them these plans, and that is illegal. So this is a list of things that plans can't do. So they can't call you if you didn't ask them to do so. They can't send you unsolicited emails. They can't ask for financial or personal information if they call you. They can't market their plans at educational events or in healthcare settings, except in common areas. And they can't compare their plan to another plan by name in advertising materials. They also can't sell you other products when they're trying to sell you health insurance. So they can't try to sell you life insurance or other non-health related products at the same appointment. So this would be cross-selling, and again, it's not allowed. They can't imply that they're calling on behalf of Medicare. Again, if it's a company, it's not Medicare. They can't have a contract with Medicare, right? If they're selling this product, they might have a contract with Medicare, but they can't say that they are Medicare. They can't say that, like, oh, Medicare told me that you might be a great candidate for this Advantage plan, like, that they cannot do that. So they might have a contract, but they're not, Medicare is not going to try to hawk you a particular plan. When you are transitioning into Medicare, so this is for people who are not on Medicare yet, we're going to talk a little bit about what that looks like. If you have employer coverage, like Claudia said, talk to your employer, figure out what their options are. Sometimes employers have Medicare options that you can sign up for. In particular, sometimes you do need to sign up for your Part B because they're not offering something, or they're going to ask you to do that. Your employer can tell you if you need to, and they can tell you if it'll be your primary or secondary coverage. And so you just want to make sure that it's creditable coverage. Otherwise, you might be facing a penalty for not having creditable coverage and not signing up for Medicare during your initial enrollment period. If your employer has less than 20 employees, you usually do need to sign up for Medicare A and B, and that would make it primary because usually they don't offer any extra stuff if it's a smaller employer. After you stop working or your employer group coverage ends, whichever is first, you have 8 months to sign up for Medicare without a penalty. So you do also have a window once you lose your employer coverage to sign up for Medicare. So you don't have to super rush it, but you want to make sure that it's something that you're thinking about and that you understand what that process looks like at your particular employer. If you have retiree insurance, it's important to talk to your benefits coordinator to find out what you need to do and what is offered, because usually those processes are very different. So you can't go to Medicare.gov to sign up for your employer retiree insurance. So it's really important to contact your human resources or the particular department that's managing those benefits because it looks very different for each employer. They may even have different plan options than what we'll be discussing today. So this is very, very common for people to come in with a plan that isn't actually on Medicare.gov. So I don't even know what that plan looks like, so I can't really even compare it to some of the stuff that is being offered on Medicare.gov. Also be aware that if you choose an Advantage plan or a supplement that is not part of your retiree benefit packet, you may jeopardize benefits that you're receiving, including health coverage or pension annuity payments. So again, once you opt out of benefits, sometimes it's really hard to get back in. So again, being clear with your employer, making sure you understand what those processes are, and then making sure that you know if you really do want to change, because sometimes, again, you might have an option that's offered to you that's not really a good fit for you. And so if you do want to go onto Medicare.gov and leave those retiree benefits, you just want to make sure you know. You want to make sure you're informed about what those consequences are. If you have TRICARE or VA coverage, you'll need Medicare Parts A and B, but you probably won't need anything else. For questions about that, there's a phone number listed that you can contact. If you have VA benefits, it does count as creditable prescription coverage. You want Medicare so that you're covered at non-VA facilities. And again, there's another phone number if you have questions about VA benefits. If you have marketplace coverage and you're about to start Medicare, you must terminate your marketplace coverage. That's part of the rules. You're not supposed to have it if you're eligible for Medicare. Coverage can be terminated online at healthcare.gov or by phone. And also we can help with that if you also need in-person assistance. You can terminate your plan as early as 60 days before your Medicare starts. And on healthcare.gov, they make it really easy. We can just log in, select the last day of coverage, and then it's good to go. So as long as it's at least 2 weeks before you want the coverage to end or when your Medicare starts, we can kind of schedule that far in advance, up to 60 days in advance. And like I said, it takes about 14 days, so don't wait until the last minute. If you have Medicaid and you're about to get onto Medicare, you can have both, but the category is a little bit different when you're eligible for Medicare. So the income threshold drops down much lower, and then there's also an asset evaluated as well. So these are things, assets are checking accounts, savings accounts, IRAs, stocks, annuities, those kinds of things. So now that is a new thing for Medicaid versus being on regular adult Medicaid. Now they're going to be looking at your assets as well as your income. So you have to meet kind of both of these requirements before you'll be eligible for Medicaid. So it does change. And I'm going to turn it over to my coworker, Chris Garcia, to talk a little bit more about making your Medicare work.
Hey everyone. So I'm going to talk about some additional programs that CCHCC can help with to cover some of those gaps that are left by Medicare, for example, the vision, dental, things like that. So first off, the Medicare summary notice. This is this little brochure packet you usually get every year. It will state all of the services that you got throughout the year, It'll usually say this is not a bill, because it'll list all of the items, and then you just kind of review it. It'll give you a good idea of what things were covered by Medicare. So if there's something that wasn't, and you want to make sure that that is next time around, that's a good comparison of what you had at that moment to what you're shopping for the next year. Another thing to keep in mind is appeals and grievances. So if you have original Medicare, there is an appeal process for Part D and Advantage plans. It starts with an internal process, and we can help out with those as well. For assistance with prescriptions, we do have an emergency prescription assistance program at our office. So this is, let's say for example, you're transitioning between Marketplace and Medicare, and there's going to be a gap. You might not be able to afford that cash value for that prescription that month until your coverage starts for your Part D. That's something that we can help with the local pharmacy that we partner with, and help that kind of take that pressure off of you for that one time. We can also do like emergency copay assistance. For dental, we do have a dental referral program. So this is a discounted program with local dentists that we partner with. That is done through our office, so you would have to schedule an appointment with one of us. We do the eligibility based on your income, and then we would let you know what the discount is going to be. We would schedule your first appointment. You can go get your consultation, your first x-ray and kind of exam for a $15 copay that you just pay up front at the time of the visit. And then from that point, if you decide to stay in the program, you can schedule with that dentist as often as you need, or you can space out the visits as far apart as you need to be able to make that payment for the services that you're getting done there. The other thing is for vision. So as Claudia said, it's usually only covered when you have cataract surgery and that one pair of glasses. We do have an emergency vision program where we can do both a free exam and a free pair of glasses with local providers that we partner with. So that's a good program as well. Like if you're transitioning between and you don't have something, or the one pair that you're really dependent on broke and you need to replace that, we can help with both the exam and for the actual glasses themselves. Some other programs that are there to kind of also help supplement your Medicare benefits. One of them is the Medicare Savings Program. So this is to help with your Part B premiums and Medicare co-insurances. So you guys saw how there's for Part B, it's deducted from your actual Social Security check or your disability benefits. And so what the Medicare Savings Program does, it's in that pink sheet in your packet. It'll essentially, if you qualify, will get rid of that. And so the Department of Human Services is covering that cost for you. So you no longer see that being withdrawn from your checks. Again, if you're interested in that, if you're wondering if you're eligible for that, we can schedule an appointment and see, get an application done, or just kind of discuss what the income requirements are for that program. Another program you might have heard about is the Extra Help, and this is for Part D prescription plans. This one is the green handout in your packets. For this one, Extra Help is an income and asset-based program. So as Adani was saying, they will look at those assets and they will ask about whether you own multiple vehicles, multiple properties, checking savings accounts, all of that stuff. If you qualify for Extra Help, you can get a zero premium plan. No deductibles and no donut hole. Some additional programs are hospital financial assistance programs. Carl has Carl's financial assistance program. It's formerly known as community care. So you may receive up to 100% discount. You could be presumptively eligible if you are dual eligible and you have Medicaid and Medicare. So that's a simple process. You submit an application, you send proof that you have that, or if you have SNAP or Link, that's another program that gives you automatic eligibility for that program. Another one is the Medicare 100 Plus program. and that is for OSF Heart of Mary Hospital. So for that one, you may also qualify for up to 100% discount. We do those applications at our office, so you would have to contact us to make sure that it's this specific application, and we expect to have all the cards themselves for this particular program that will come in directly from us by the beginning of November. And sometime in November. So I think we have another handout. If you're curious or want to learn more about the providers that are in that, we can help you figure out if that might be something that might benefit you. Other services that we offer, I don't think anyone raised their hand for Medicaid, but other programs like the Medicare Savings Program, that's done through the same application as Medicaid and Link. And so we can help with redetermination for those. We can do change of addresses, report income changes, the SNAP, the termination of marketplace plans, prescription assistance, SafeLink. So if you're eligible for Medicaid or SNAP or Link, you can also qualify for the free phones. And then there's just additional programs that if you just have questions about, you can take appointments or just over the phone answer some questions to clarify. Thanks.
So this is the part of the program where if you have questions, we might have answers. And so we'll be taking your questions. If you don't want to ask your question publicly, that's fine. You can hold it, and then we'll have some time afterwards where you can come up and talk to us. So if there aren't any public questions, then we'll switch over. Okay, we'll start with you.
Would you mind putting back up the SHIP counseling resources?
Yeah. Yeah, just a reminder that Candace from OSF Heart of Mary is at the back table. She's not sitting there right this second, but she is there, and so if somebody is interested in scheduling an appointment, you can actually go and talk to her while you're here today, and she can get you scheduled with an appointment.
Thank you.
Hang on just a second. Yes.
If somebody had just started a Part D plan, say a couple months ago, they've got a plan for 2018. Does that plan last for 12 months or
It's
no?
yearly. It's for a calendar year, so the Part D plans and the Advantage plans are set up for calendar years. So that 2018 plan, the way that it is exactly right now, is only going to be that way through December 31st of 2018. They could renew that plan. They could discontinue that plan, so that's why it's important to keep track of the mail that comes from your particular plan, because there might be changes. Even if that plan still exists for 2019, there might be changes, but that plan could very easily not exist for 2019, so you would want to look into a new Part D plan for 2019.
So it's for calendar year, not 12
Exactly.
months.
Yeah, there's calendar year.
What are the exact procedures for changing Part D? I'm going to cancel, do I have to cancel that first, or do you just apply for the new one, that gets canceled? How does that work?
So on Medicare.gov, you will be able to enroll in a new plan, and that'll automatically cancel out. As long as your previous plan is also just a regular, publicly available Medicare, Part D plan, it'll be automatically canceled when you sign up for another one. So Medicare will let the other plan know this person has chosen a different plan. They are now on this plan. And so that'll be automatically canceled. So you don't have to do anything extra. If you'd like, you could contact your Part D plan just to be 100% sure, but usually they get that information. Medicare gives them that information. And then we have some over here.
Do you have the names of the dental and the vision provider?
No.
We don't give out those names publicly because that's part of our arrangement with them. If we were to give their names out publicly, people might just show up at their offices and they would get annoyed, and we want them to stay in the program. And that's why we say all that whole process is through us. If you come to us and you're interested in that, you know, every now and then you might find out that your dentist is actually participating, and then we just sign you up that way. But yeah, we don't.
Always just check with you guys.
Yeah, if you want to enroll in those programs, and then we help do the paperwork that qualifies you for it. Thank you.
If I enrolled for Medicare and Part B, and I have a supplement and Plan D, now if I wanted to switch to an Advantage plan, do I still have to pay for the Medicaid Part B?
The Medicare Part B?
Yes.
Yes.
So even though it's covered by Advantage plan, I would still have to pay it?
Yeah, because what happens, the way it works behind the scenes is that if you get on a Medicare Advantage plan, you will probably have a pretty low monthly premium. That's not the total cost of the premium for that plan. What happens is that the government is paying for part of your premium, and they collect the payment through when you're paying your Part B premium, or it's getting taken out of your Social Security. The government, you're sort of in a cost-sharing agreement with the government to pay for that Advantage plan.
So is the Advantage plan usually better than the other one? Or is it, you don't
That
know?
is not a question we can answer.
Okay.
It's going to vary between every single person. It's going to be different based on every single person's needs.
Okay.
Yeah, it's really up to the individual. And when we sit down and work with somebody, we just work with them to figure out what might best meet their needs.
Okay.
In general, the things that people like about Advantage plans, you know, just to help give some information about that, is that, you know, like we said, a lot of times they bring more benefits with them, like maybe some vision, maybe some dental, you know, every now and then some hearing, you know, things like that you wouldn't have under Medicare and a Medicare supplement. Because remember, a supplement, you know, is just exactly in line with Medicare. Whatever Medicare covers, the supplement will cover, but it doesn't add extra benefits. Whereas an Advantage plan might add extra benefits. It's also, you're dealing with one insurer instead of a supplement and then a Part D and, you know, and all that. Yeah. The other thing that people like about it is that the costs are very predictable. You know right up front what your copay is going to be for a doctor's visit. You're not waiting for the mail to come back and tell you, you know. But it really varies. And like Adani was saying earlier, you really want to look at, like if you get a lot of labs drawn, for example, you want to look for a plan that's going to, you know, cover that without copays and stuff. So it's just, that's why we encourage every person to like sit down and look at things, and if you need to sit with an expert like Candace or, you know, come to our office, you know, we'll help you look and think about what you need.
Okay.
So, I would be very interested always to get a second opinion for a diagnosis. So I'm thinking in my mind as I age that it might be a better idea for me to go with the Advantage plan, because if I want to go to Mayo's to get that verified other than Carl, I could do that?
So I think so. An Advantage plan has a network. So you would deal with networks versus a supplement which doesn't have a network. You're paying more money but it doesn't have a network because it's just following right behind Medicare.
Okay.
So if you're worried about network issues and kind of dealing with the bureaucracy.
And that's individual.
Yeah, and that's individual. Again, a supplement will have less of that because it's not like that supplement isn't having a contract with a doctor or a hospital. It's just following, or a PPO for an Advantage plan.
Okay.
Yeah, so in that example, you might be better off with the supplement.
Okay.
Unless your Advantage plan covers you at Carl and at Mayo.
Yeah.
Right. Right. Which is possible.
Right.
Like with United Healthcare.
Exactly.
Yes.
Thank you.
Exactly.
Okay, got it.
Yes, sir.
Yeah, I'm interested in getting a Plan D for drugs, but I saw that you have for Plan Ds that the monthly cost could be $24 to $75, but you have the Advantage plans of $0 to $71. But now the Advantage plans covers your prescription drugs now, and other things. So I mean, what am I missing?
So those costs are just the premiums, right? So the thing we kept saying is you can't just look at the premiums, right? Because all of those plans are covering different medications. They're covering different things in different ways. And so ultimately for you, that cost might look very different per those plans. It's not just the premium cost, right? Does that make sense?
No.
It depends on
It depends on your prescription.
Yeah, but let's say I'm going to take one of the higher tier drugs, okay? But if the maximum, from what you said, for the Advantage plan is $71, and of course Medicare is paying their part into that too. But for me, the cost would be $71. Would that give me the upper tier?
It doesn't work like, they're not priced like that. They're not priced like, oh, this is the best or the most expensive one. It's not priced like that at all.
Okay.
Which drug you pay it?
You can look at monthly premiums and see which cost is better for you that way. But when it comes to medications, each plan, whether it's an Advantage plan or a Part D plan, they all have different formularies. If there's something specific that you need, let's say you use an inhaler. Inhalers are like really expensive. And you use a specific inhaler, and through trial and error, this is the one that you have to use. You might see that under that Advantage plan that looks attractive, that actually that inhaler is not covered well, and it's gonna cost you a lot at the pharmacy.
Okay.
So those are the kinds of things that you have to compare. On the face of it, you're correct. You sort of get more bang for your buck in terms of like the premium dollars. If somebody is pretty healthy, doesn't take a lot of prescriptions, or doesn't take high cost prescriptions, they might very well make a decision based on the cost of the monthly premiums. But if you have specific needs, you really need to compare kind of the formularies before you make that decision, because it's the cost at the pharmacy once you get to the pharmacy. It's complicated.
Yeah, so if that inhaler is $300 every time you fill it, that's not the most affordable, even though your premium is the cheapest or the best one or whatever, that extra cost is not actually worthwhile, whereas maybe there's a different plan that has maybe a lower premium every month, but it covers your inhaler, so your costs at the pharmacy are actually lower. Because you're really looking, the formula isn't just including the premium cost, it's including all the other healthcare and medication costs. So that's the formula you should be looking at, and not just the premium.
I knew there had to be something there.
I was just going to give an example real quick. I take care of an individual who is brain injured, and 1 year at the end of 2016, he had a heart attack. And he had a Part D plan and all that. He survived his heart attack and was doing fine. But they prescribed him a medication called Brilinta, which you may have seen on TV or may have experienced. But Brilinta is a new sort of anticoagulant medication so that the stents don't get blocked up. Very effective. The person only takes it for a year. But when I went to the pharmacy to fill his prescription, I had really bad sticker shock. It was like $300, and it was going to be $300 every single month for a year, and his Part D plan didn't cover it. So sometimes there's things you don't anticipate. Now, the beautiful thing, Adani actually helped me figure out that this individual qualified for both the Medicare Savings Program, so his Part B premium started getting paid that way, and he didn't have a deductible, and then also for the extra help, Part D, and so he no longer had to pay for his insurance premiums on Part D. He didn't have a deductible, and then if you get extra help through Part D, the insurance companies actually can only charge you between like $3 and $8 and a few cents per prescription. So that actually turned everything around.
But income based.
Yes, it's income based, and you have handouts on that. But the point of that story is really both like about the Medicare savings and the extra help. But the point of the story is that you don't always know. You try to plan ahead. We'll work with you, try to help you. There's that formula to consider. But then sometimes things happen, and you're prescribed a medication, and it's not on the formulary, and then you get that sticker shock. You're welcome. You had another question.
If I'm on Obamacare now. Now, do I have to go off Obamacare and get Medicare when I turn 65 or when I start collecting Social Security?
Whichever comes first. So 65. 65 is the answer, sorry.
So even if I work longer before
Yes.
collecting, I
Yes.
still have to do this when I...
Yes, because the marketplace plans, also known as Obamacare, the marketplace plans will only cover you up to 65. As soon as you turn 65, those plans are not for you anymore. And yeah, you can make the
You can
schedule
schedule the day that you want it to terminate. So you just want to make sure that you turn that off. Otherwise, you're going to be getting a subsidy, and you might need to pay that subsidy back if you were supposed to be on Medicare that whole time. So yeah.
Other questions?
Do you do both Medicare and marketplace plans?
Yes, we do.
Yes.
And by we, I mean they do.
Yes.
Yeah, you can schedule an appointment. We actually had an Affordable Care Act marketplace, an ACA marketplace open enrollment community meeting last week, or 2 weeks ago. I don't remember. But, yeah, so we can help with that, and then we also have information on our website. And this presentation and our PowerPoint presentation, we'll put it up on our website as well. And then, y'all have handouts and stuff that you can take with you.
Video, like a video?
The video,
Yeah,
yep, we'll put it up there. Yeah, if somebody wants to sit through all that, that's fine.
It'll be on YouTube. You can fast forward your parts.
Oh, yeah, it's on.
As we age past 65, shouldn't they make Medicare less complicated? So I really don't understand why it gets so complicated.
Yeah, it's increasing.
Is there anyone that we can advocate to make this less complicated?
You could talk to your senators. Senator Durbin is actually really knowledgeable on Medicare, and he.
It's not going to do much right now, given.
There's nothing. There's no legislation on the horizon to do that, but it is increasingly complicated, and part of the reason that it's increasingly complicated is because the way that Medicare was first designed, with the Part A and the Part B, and then your responsibility for the 20% and the deductibles and the premiums, a lot of people have found that unaffordable. So then private insurance comes along, but because it's Medicare, that insurance really needs to be regulated so that
they don't take advantage.
So that they don't take advantage of people. So there's rules and regulations for that. But then, prescription drugs in our lifetimes, we all witnessed it. They're young, but we witnessed it. Where prescription drugs, remember, you didn't used to see them advertised on TV because there was a prohibition on that. Now you see them advertised on TV, and then at some point in time, the cost of prescription drugs just skyrocketed to where it became a bigger part of the whole healthcare cost. And then that necessitated, that's when a lot of people started advocating for a Part D plan or some coverage, but that didn't come from Medicare directly. That came from, again, working with private insurance plans. So it is complicated, and that's why we do this work, because we do realize that people need help. And one of the worst things that we see, in terms of our clients are, we will sometimes see individuals who didn't sign up for Part B when they became eligible. Maybe they didn't understand it, or they didn't think they could afford it, or they didn't think they could need it. And then they show up to our office when they're in their late 70s or 80s, and they get a horrible cancer diagnosis, and most of their care is going to be outpatient. And then Adani and Chris have worked some miracles with people to help get them covered. But we just thought we need to do a better job of helping people prepare to turn 65 and get Medicare. Really but I appreciate your sentiment. It is.
We agree.
And also, they charge you more if you don't get it right away.
Yes, there is a penalty. And so, sometimes we're able to negotiate something for people, but you never know. It's not worth the risk. And that's the other reason that we really want to try to help people understand about the Medicare Savings Program, because if you're getting ready to sign up for that Part B and it feels like it's too expensive, we want you to know that you might be eligible for the Medicare Savings Program, and that could help reduce the costs, and that way you could get your Part B and not miss out on it. So.
Now, I take insulin, and it's very expensive. And when I hit the donut hole, I'm going to have to pay like almost $800 a month for my prescriptions.
Yeah.
Would I be eligible then to apply for some kind of help? Or is that?
You would have to look at the income guidelines. You
Oh,
still have
okay.
to. You still have to take a look at that income
Okay.
guideline. See maybe if extra help can help with that.
Yeah, I mean, I would encourage you to work with Adani or Chris to look at whether you might qualify for extra help. And one of the other things that we know is that insulin.
They don't make generic.
Well, and for no good reason right now. Insulin is getting very expensive. It's one of the key drugs where the prices have just shot up. And so a lot of people are feeling the pain from that. So, but yeah, and then people can't always switch from types of insulin.
Right.
Yeah. So, yes.
Back onto the drug thing again. If you're going to have an operation at the hospital, and you're going to have, pay medications or whatever, does Medicare B pay for that, or do you need a Plan D to be paying for your hospital stay, the operation?
Whenever you're in the hospital and you get medications while you're in the hospital, all of that is covered under Part A. It's when you get sent home with a prescription, that's when you're going to have to go to the pharmacy, and that's where your Part D would kick in.
Now, everybody I'm sure gets these cards in the mail from nowhere.
Yeah.
And so after I retired, I took the card and I got eye drops is the only thing I take. And I used to pay with my employer health care $80. And I went here and I paid $40 with that card. I mean, where did these cards come from? I mean, it's better than my employer insurance. I mean, what is this?
Well, I think that what the pharmaceutical companies realized is that they kind of price their product out of people's reach for a lot of people, and then a lot of insurance plans don't cover those. That's another thing that can be very expensive, right? The specialized eye drops. And so there are these like discount programs. You get those cards in the mail for the discount, and you can use them at certain pharmacies or most pharmacies. And basically, that's sort of a lot of times it's like sort of through a pharmaceutical company just to help make their drugs more accessible to people, more available. But yeah, that's another thing where things are getting so complicated is, sometimes separate and apart from those discount cards, sometimes people are finding out that their prescriptions are actually cheaper if they don't run them through their insurance.
Well, can you do that? If I'm on Part D, but I can get prescriptions easier with the card, cheaper, can I use the card? So you can use both.
You can use both. Now, a lot of times that doesn't apply to like insulin. But yeah, you could to avoid getting you closer to the donut hole sooner.
Because my eye drops cost $120 even with my insurance.
Yeah. It's always worthwhile to ask your pharmacy what this prescription would cost if there's no insurance to go with it. And sometimes you'll be surprised. And I think they just passed a new law, or I'm trying to remember now. I think they just passed a new law that says that pharmacists have to tell you, because the insurance companies didn't want the pharmacists to tell you if you ask that question. We always have to be on our toes.
In fact, I know a case like this recently at Walgreens.
Walgreens.
This woman went up and all of a sudden the sticker shock, this medicine, and then they told her, well, there's a special program with a coupon or whatever. And then she goes, wow, if it hadn't been for that,
A lot of times, like pharmacists and the pharmacy techs can be really, really helpful. Yes.
I worked in pharmacy, so I was a technician. And one of the main things they do, though, is if you're on Medicare, a lot of those cards cannot be used.
That's what someone told me too.
Yeah.
It varies between the card, and it varies on what your insurance is.
GoodRx is the main one that takes for everything and anything, and it'll take and fix you for, like, if you go Walgreens, CVS, or wherever your cheapest price, it'll give you that on the internet.
GoodRx. And you're saying you can look up the prices on the internet?
Right.
Great.
But, I mean, just to put it out there, these prescription prices are totally non-transparent.
Yeah.
It's all done with smoke and mirrors. I have no idea whether there's any relationship between supply and demand.
No, the U.S. doesn't negotiate, or like Medicare doesn't get to negotiate drug prices, even though it's like the biggest insurer.
And some of the prescriptions aren't even covered.
Yeah, and that's why bringing it back around to open enrollment for Part D, that's part of why it's also always so important every year if you have a Part D plan to check the formulary. If you like your plan and it's going to continue, you still have to check the formulary because they're allowed to change the formularies. And you might find that your plan doesn't work for you anymore with what you take and you need to go to something else. This stuff is really complicated, and it gets especially complicated once you have certain prescriptions. So, yes, sir?
An example to this gentleman's inquiry, I initially went with a very low premium on my Part D, and a year later they changed the tier of one of the things that I take. They dropped the premium, but I end up paying about $30 more because it's no longer free.
Exactly.
So you got to add up the total of your costs for your prescriptions and add that to your premiums and see which way you come out best. Because that's why I'm here. So I'm planning on changing to another lower premium that didn't raise that medication to the next tier.
Yeah, it is. They can change at any time. They're going to keep you on your toes, and that's what we're here to help with. One more question, and then I'll say some comments to wrap up, and then if you need to talk to us individually, you can.
I'll say for that example, Medicare.gov is really good about letting you know what your monthly cost is going to be, and so you can kind of gauge where you might fall in that donut hole. And you can input all your prescriptions, so it will narrow your plans down so that you're choosing the ones that are going to fit that necessity.
For the Medicare.gov?
Yeah.
Yeah, when you're looking at Part D plans, have your prescriptions with you, so you can put that information in. It's really handy. Candy, back there, Candace?
Yeah, I just wanted to say that the Senior Health Insurance Program, SHIP, is a free consulting service. So just because we're in OSF Hospital, we don't recommend that you go to OSF. We don't recommend you go to Carl. We are actually not allowed by the state that trained us to tell you need to take this insurance or this insurance. We will go through it with you and give you your options, and you make the decision.
Yes, thank you for citing that again. So another reminder, if you need help, you can schedule an appointment with Candace from the OSF Heart of Mary SHIP site. And like she said, there's no charge for the services and no strings attached. And so a lot of people need help because this is complicated. Okay, well, thank you for helping to answer questions. We are now concluding the formal part of our meeting, and I wanted to thank Paulette, Adani, and Chris for their presentations. And again, the slideshow and the video, if you want it, will be available on our website probably by early next week. Yeah. The person who does all this doesn't work on Friday, so early next week. And also I want to invite all of you to get involved with our Medicare Task Force. The Medicare Task Force is a group of Medicare beneficiaries who are working together to improve the lives of local Medicare beneficiaries. It was their idea many years ago that we hold this kind of community meeting every year. They deal with many different Medicare-related issues and figure out what we can do in our community to make improvements and advocate for policies. The meetings are once a month on the third Thursday of the month. Our next meeting for the Medicare Task Force will be on Thursday, November 15th at 11:30 a.m. here at the library in the rooms across the hall, and we do provide refreshments. So now that we are done with our presentations, please feel free to visit with us and also with Candace and pick up information if you need it. And thank you, everybody. And remember, if you have questions or need help, you can always call us, and all our information is on the handout, and Paulette is pointing at the refreshments. So please help yourselves. Thank you very much.
Thank you.
Yes.
I'm Angela.